Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country.
Welcome to another episode of Native Bidaské. My name is Levi Rickert, publisher and editor of Native News Online. I'm joined today with our senior health reporter, Jenna Kunze, our lead reporter on Healthcare Beat. Today's episode is part of Native News Health Desk reporting initiative to cover healthcare in Indian country.
Thank you to our platinum sponsor, the American Dental Association.
Today we have a special guest, and it's Phyllis Davis, who's a tribal citizen and tribal council member of the Gun Lake tribe of Potawatomi here in Michigan. And she's actually about 25 miles, her office is about 25 miles where I am here in Grand Rapids. So welcome, Phyllis, and it's good to see you. We saw you in Washington, D.C., Jenna and I both, and we thought it'd be great for you to come on Native Bidaské and talk about what's going on in healthcare. And the big buzzword these days really is advanced appropriations. And Jenna, why don't you have the first question?
Okay. So Phyllis, can you explain for us what the difference between mandatory funding and advanced appropriations is?
Okay, so mandatory funding has to do with the process of how tribes are funded, not only for, say, the IHS contracts or compacts, but also BIA and how we receive those funds. And a mandatory process for tribes would mean that regardless of what's happening with the budget and interests of Congress, that we would get the funding that we need to provide those services every year. And it wouldn't be a discretionary pot of funds that our funding really does come from, like it does now. You know, that it's dependent on what the budget is, what the priorities of the administration is,
Right.
you know, in the country and around the world, you know, and that's typically where we fall, this the inability to fund us because there is something happening somewhere else. You know, it diverts funds from tribes, essentially, which for me means that we're unable to fulfill our missions to provide healthcare services. The mission of the Indian Health Service is impacted because they can't do the same. They can't fulfill their agreement to tribes. So it's a big thing. And advanced appropriations, you know, is another pathway for us to at least say we can provide some continuity of care. You know, that healthcare services or direct care services programming for tribes is not interrupted, which is, you know, detrimental overall.
Can you give an example? I'm just thinking, like, what else is discretionary funding according to the U.S. government? Like, it'd be interesting to compare, like, Indian Health Service, which is essential, compared to what else is considered discretionary.
Well, probably something like a nutrition program, maybe USDA funds. I'm not sure if those are mandatory or not. I'm really not, but I think I could, you know, say that could be something that might be on the chopping block if there's cuts, you know, because we submit our budget of what we need. And there is a back and forth that happens, and it eventually it's up to the president about what he wants, which goes to Congress, and then they do what they want, where they want to move funding, take away to move into another, you know, so everything's in play here for the most part, unless they're mandatory functions or programs.
Phyllis, let me just ask this. As a Indian Health Service is one of really, I guess, the only federal agency that has to go back every single year for their appropriations versus the Veterans Administration and Medicaid and Medicare. As a long-term, and you are now a former health director of a tribe, the Gun Lake tribe, and you've been on several committees through the years, regionally and even nationally. Tell me this: does the U.S. government have trust responsibility to Native Americans?
Well, absolutely. They have a trust responsibility to every tribe in this nation. We were here. We were the original inhabitants of this continent, and that has been for millennia. And, we had an invasion, an essential takeover of our land. And this was ended up in some very dark and horrific times for us as original people from here. They negotiated through treaties all of our land and removed millions of people from their homelands. And even for the Potawatomi Nation, we were scattered to the four winds, and many like Levi's, his tribe, they're in Oklahoma, they're in Kansas. We have people in Wisconsin, Canada, Michigan. We were disbanded and spread out. And so, those treaties were signed by our ancestors. And the U.S. federal government told us that they would honor those treaties by providing health care in exchange for that. So, this is a honorable duty that they need to fulfill. And we have been saying this for, hundreds of years. And at some point, that acknowledgement needs to happen. And there needs to be a way to fund tribes without doing more harm.
And we shouldn't have to go back every year and petition. It should be. I love that word mandatory.
Right.
Most people understand what mandatory means. I mean, it should
Right.
be written in for all time, given the trust responsibility.
Right.
Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible.
Right.
Jenny, you have another question?
Yeah, I think that it would just be helpful for viewers too to understand like what Chief Francis of the Penobscot Nation was saying at the Tribal Health Summit in DC. The on the ground impacts, and you've said some of these things, you're like, the police don't get funded, the ambulances don't get funded, but can you speak of a specific example maybe that your tribe has experienced or that you've experienced as a healthcare worker, which you said that's how you started, when funding gets slashed?
Well, I can think of, I believe it was in 2018. My mind is kind of not for sure, but I think it was 2018. We had a continuing resolution, and then we ended up the end of the year. The continuing resolution had expired, and they had not renewed it. So Congress shut down. This had a huge impact on tribes. When your region is funded at the lowest of all 12 IHS regions, the Bemidji area tribe suffered in great numbers. So many of them had to furlough. I know of tribes that furloughed, 7, 8 providers because they didn't have the funding to pay them. The administrative portion, the impact to shut down clinics because they didn't have doctors or nurses to see patients. Construction projects where maybe there was a tribe that was working on expansion program, they had to stop because they were only funded at a percentage, which that got them through, a couple months. And so that kind of uncertainty really, it's devastating to every Indian who uses a tribal health center, and tribes invest time, money, energy. They want the best, and they look and recruit for the best. That's another thing that's happened in my region here is the inability to recruit and retain good providers, medical providers. There's such a need for them across the country. Regions are looking at 25 to 30% vacancy rates. They cannot fill, you know, staffing levels. So when you look at that, you're already impacting the health care of your people. But to not have the funding to put out a good recruitment package, to try to bring in talent. If a provider has an idea or a history of IHS and they look, oh, this happens every year, this is not security for me. I can't do this. So, it catches us into a system that really has a negative health impact on the health of our people.
Yeah, and Phyllis, I know historically, it used to be said, and help me out with my remembrance, that if you had to go to a IHS facility after, was it July, you may not be able to get served because they had essentially run out of funds. Now, the good news is the president asked for, I think it was over $9 billion this year, and it looks like, and it's still pending, and this is perhaps even today they'll vote on it. This is showing on Friday. So I guess my question is, what's the proper level would you say IHS should be funded at? You've been at this a long time, so I feel real comfortable asking you the question. Is $9 billion just really part of what's needed, or is it really 15 or 12 billion? Do you happen to know what that number would be?
Well, I think that depends on who you're asking. For me, I've been working with the National Tribal Budget Formulation Workgroup for many years, and bring the regional needs from the Bemidji area to this work, to show what we need, is something that I enjoy and advocate for. And I know that when we look at this number and say, what is that ideal number? We're nowhere near it. 9 billion is a nice number. It's 3 billion more than what we received, last year. But, over the years, tribes have asked, what is that ideal number? And, there's been a process involved to bring that up. Maybe we're looking at 54 billion. Maybe we're looking at 60 billion.
Wow.
The IHS is not funded at 100%. The level of need funding right now for tribes is around 54% of what they actually need. So when I think of my area, the Bemidji area, and being funded at 54% of what I need, my tribe is a small tribe, but if I could have that optimal amount, the work we could do would be amazing. Just the expansion and the type of services and programs that we could deliver would be a dream come true for every tribe in this country, to be able to offer them the best and the most optimal healthcare system that they would ever want.
And the thing that I think the viewers need to remember is, when you're talking about healthcare, you're talking about saving lives. And if there's not enough funding, people are dying. And in terms of life expectancy of Native people, and Jenna, you've covered some of this. It seems to me we're going backwards sometimes.
Yes.
The life expectancy of Native Americans.
Absolutely. Yes, there was a CDC report that came out this summer that had stated through findings that we have lost 7 years off our life expectancy.
Right.
And with COVID and the impact that COVID has had on American Indian populations has been, 2-3 times higher than the national average. And the long-term implications, we don't even know what that's going to cost a patient who has had COVID once or maybe twice. We don't know what that could mean to them. So, we need to keep looking at funding resources and continue to demand that we receive advanced appropriations, that our funding is moved over into a mandatory process, and that we're funded at 100%. I mean, this is, I don't think it's unreasonable for tribes to continue to make those demands and requests.
Thank you to our platinum sponsor, the American Dental Association.
And Chimigwech to Phyllis Davis for coming on Native Bidaské. Wishing you a Merry Christmas, Happy Holidays to you and yours. And Phyllis and I have been friends for many, many years. We're basically neighbors. And so, Chimigwech, and to our viewers, Chimigwech for tuning in to another episode of Native Bidaské. And we will be back next week with special guests. So have a safe holiday season. Chimigwech.
Hey, miigwech and bamapi. I appreciate this.
Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible. If you appreciate what we do here at Native News Online, we invite you to donate to support our continued work covering Indian country. You can scan this code with your smartphone or go to the link located below this video to donate today. We greatly appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to scan this code or go to the link below to subscribe to our newsletter. Thank you for joining us today, and please be sure to join us again next week for another episode of Native Bidaské. Chimigwech.